Today we're going to talk about something fascinating, a condition that takes what we think of as a strength, flexibility, and turns it completely on its head. We're diving into Ehlers-Danlos syndrome. It's a group of disorders that mess with the very scaffolding of our bodies, and in the process, they show us just how crucial that hidden framework really is.
So let me just ask you this. What if your body was literally too flexible? I mean, think about it. Joints that bend way past where they should, skin that stretches in ways that just don't seem possible. This isn't some comic book superpower. For people living with Ehlers-Danlos syndrome, this is their reality, every single day.
All right, so let's get into it. How does this actually look? Well, it shows up in some pretty striking ways, where the body's natural elastic limits are pushed, and sometimes broken.
You've probably heard this phrase before, the rubber man syndrome. And yeah, it sounds kind of sensational, like something out of a circus act. But it actually points to something very real for some forms of EDS, extreme skin hyperextensibility. It's a wild image, but it really drives home just how fundamentally different the body's tissues can be for someone with this condition.
Okay, so what are we actually talking about here, scientifically? Ehlers-Danlos syndrome, or EDS, is a group of inherited disorders that hit our connective tissues. And you have to remember, connective tissue is, well, it's pretty much everywhere. It's the support system for our skin, our joints, our blood vessels, even our internal organs. It's the stuff that holds us all together.
Maybe the easiest way to picture it is to think of our connective tissue as the body's glue. It's what gives us our structure and our stretch. Well, in Ehlers-Danlos syndrome, that glue has a flaw. The formula is not quite right, and that makes it weak.
Now here's where it starts to get even more interesting, and honestly, a lot more complicated. EDS isn't just one single thing. Nope, it's a whole spectrum of disorders, and each one comes with its own unique set of problems.
So, just how common is it? Well, the official estimate is that it affects about 1 in 5,000 people. Now, that might sound rare, but the impact on those folks and their families is massive. And here's the thing. Because the milder forms can be so hard to spot, a lot of people think the true number could be way, way higher.
So let's just look at 3 of the main types to get a feel for this spectrum. You've got the hypermobile type, which is all about joint instability. Then there's the classical type, which is where you see that really stretchy, fragile skin. And then you've got the vascular type. This one is the most severe because it makes blood vessels and organs incredibly fragile, which is, as you can imagine, incredibly dangerous.
Let's really compare those two extremes, right? With hypermobile EDS, your daily battle might be with chronic pain and joints that dislocate all the time. It's debilitating. But with vascular EDS, the threat is invisible and terrifying. There's this constant looming risk of a major blood vessel or an organ just rupturing. It's such a stark contrast, and it shows you how two people with the same condition can have wildly different lives.
And check out this detail that really helps tell the types apart. People with the classical type often get these really unique scars. They're sometimes called cigarette paper scars because they're so incredibly thin and crinkly. It's a visible, everyday reminder of just how delicate the tissue is just beneath the surface.
So, we've seen the effects, we've seen how it looks on the outside, but what's actually causing it? What's going on at the root of the problem? To get that, we have to zoom way, way in, down to the molecular level.
It really all boils down to one crucial protein, collagen. You've probably heard of it. So here's what happens. It starts with a genetic mutation, basically a typo in the instruction manual for how to build collagen. Because of that typo, the body gets the wrong instructions, so it ends up making collagen that's weak or just not enough of it. And since collagen is the main ingredient in that glue we talked about, the result is that system-wide fragility that causes all the symptoms.
Okay, so if this complicated, with all these different types and overlapping symptoms, how in the world do doctors figure out if someone has it? Well, as you can probably guess, it's anything but simple. And this is where the journey can get so frustrating for patients. A lot of the time, the diagnosis is based on a physical exam and family history, but so many symptoms overlap, and a lot of people just don't fit neatly into any one box. It can take years of confusion and uncertainty to get a real answer. Genetic testing can help, for sure, but it's not always available, and it doesn't always give a clear-cut result.
But there is one situation where getting that diagnosis is absolutely critically important. For the vascular type. You see that phrase, dire prognosis? That means getting it right can literally be a matter of life and death. Finding that specific genetic flaw lets doctors be proactive, to constantly monitor for those life-threatening risks, like an aneurysm, before it's too late.
All right, so you've been through the ringer. You've finally got a diagnosis. What happens next?
How do you live with a body that's this fragile? Since there's no cure, life becomes all about management and prevention.
And managing EDS is like walking a tightrope every single day. It can mean giving up sports to protect your joints. It means any kind of surgery has to be planned with extreme caution. For people with the vascular type, it means regular scans, always on the lookout for danger. And huge life choices, like pregnancy, become incredibly complex decisions that carry serious risks.
And this brings us to one of the most difficult parts of this condition, a real paradox. So you've got a joint that's been damaged by dislocations. The obvious answer is surgery, right? But here's the problem. The very tissue the surgeon needs to stitch together is often too fragile to even hold the sutures. It just tears. I mean, think about that. How do you repair something when the very material you're working with is the source of the problem?
Which leaves us with this one final, really heavy question. How do you manage a condition where the standard treatments can be just as risky as the symptoms? It's a challenge that researchers, doctors, and especially the patients and their families have to face down every single day. And it's a powerful reminder that the body's hidden blueprint is more complex and sometimes far more fragile than any of us can imagine.